Next, we're going to go for the humerus, and we know that we want to make sure we look at the head of the humerus, and that needs to be facing medially, and we look at the olecranon fossa, and we know that that needs to be facing posteriorly. So we know that we have a what humerus right here? Correct, a right humerus. So what we want to do is we're going to focus on the distal part of the humerus this week. So we have starting on our medial, remember this is our medial side and our lateral side, we have our medial epicondyle and our lateral epicondyle on the sides. Then as you're right next to the medial epicondyle is the trochlea, and right next to the lateral epicondyle is the capitulum. We have a few fossas on the humerus as well. On the anterior side, we have the coronoid fossa, and then we have our radial fossa right here, a little bit more lateral. On the posterior side, we have our olecranon fossa that we talked about earlier. Right next to the condyles, we have the lateral supracondylar ridge and the medial supracondylar ridge. We're going to go over a few bony landmarks of the radius before we determine if this is a right or a left radius. There is, on the proximal side, we have the radial head with the radial neck, or the neck of the radius right underneath it. On the posterior side, we have the radial tuberosity. As we go distal, you can see that we have the styloid process of the radius that sticks out right here. And on the opposite side, we have the ulnar notch. As you can see, it's a flat spot right where that will articulate with the ulna. On the anterior side, right in the middle, you can see right there, we have the tubercle of the radius, also known as Lister's tubercle. To determine if this is a right or a left radius, what you need to do is you need to determine where the head of the radial styloid process is. The radial styloid process is always going to be on the lateral side, and we know that the ulnar articulation has to be facing medial, so that way it can articulate correctly at the joint. The next bone we're going to go over is the ulna, and there's a few different parts on it that we're going to need to identify. So first we have our olecranon process, and we have our coronoid process. We then have our right underneath is our ulnar tuberosity. We have up on the olecranon process, we have our trochlear notch, and then down by the coronoid process, we have our radial notch right here. The last thing that we have is down on the distal side is our styloid process of the ulna. Now, to determine if this is a right or a left ulna, remember that the olecranon process fits into the olecranon fossa of the humerus, so we know that this faces posteriorly. You then look at which way the radial head will fit, because remember that your ulna is on the medial side. So we know that this is a right ulna. We're going to start going over the bones of the hand, and we're going to start with the carpals first. Please make sure that you notice that we are on the lateral side or the thumb side first, okay? So we have right here, we have our scaphoid, and remember that your scaphoid is also called your navicular. Next to your scaphoid, we have our lunate. Next to the lunate, we have the triquetrum right there. On more of the anterior side of the triquetrum, we can see the pisiform, that bump that sticks out right there. After the pisiform, we have right here is our trapezium, followed by our trapezoid, our capitate, and our hamate. And on the hamate, you also need to look on the anterior side right here. It has a hook of the hamate. So the hook of the hamate sits right next to the pisiform. So we're going to go over the metacarpals and the phalanges next. So it's important to make sure you know where we're oriented again. Remember, on the lateral side, or the thumb, that is going to be the first metacarpal, second metacarpal, third metacarpal, fourth metacarpal, and then the fifth metacarpal. With the metacarpals, they're aligned a lot like the metatarsals. On the distal side, we have the head of the metacarpals right here. We have the shaft of the metacarpals, and then we have the base of the metacarpals, and those line up right with the carpal bones. For the phalanges, they're also aligned just like the foot was. So we have 5 proximal, 4 middle, and 5 distal phalanges, because remember that the thumb only has the proximal and the distal. So we have our first proximal phalange, our first distal phalange, our second proximal phalange, our second middle phalange, and our second distal phalange. And that's the same for 3, 4, and 5. We're going to go over the ligaments of the elbow, and as you can see, right here is our ulna, and right here is our radius. Okay? Right here, we have our ulnar collateral ligament. On the radial side, we have our radial collateral ligament, and what wraps around right here is our annular ligament. So we have a few ligaments in the wrist we're going to go over. We have our radial collateral ligament, our ulnar collateral ligament, and then we also have, and then on all of our phalanges, we have the ulnar collateral ligament and the radial collateral ligament. And remember, those align with the bone. So this would be our radial collateral ligament of the second metacarpal phalangeal joint. Okay, so see how I did that? And that's how you're going to relate that to all the rest of the joints. We're going to go over some other structures that are found within the elbow, wrist, and forearm. And the first one we're going to talk about is the interosseous membrane. And remember, just like the foot, that interosseous membrane is what goes in between the radius and ulna and connects the two bones for a thin sheath-like structure. The carpal tunnel is more distal, and this goes and is a tunnel that allows tendons, vessels, and arteries and everything to go through from the forearm into the wrist, and that's going to be right in this area. The thenar eminence, think of thenar means thumb, so thenar eminence is going to be this space right in here. You can see it on yourselves. It is this fat pad right here, okay? And on the models, it is located right in this area. So this is the thenar eminence. Just like the thenar eminence, we have a hypothenar eminence, so think of smaller. Hypothenar eminence is right here, okay? On yourself, you can find the hypothenar eminence located right here. And on the skeleton, our hypothenar eminence would be right here. There's a few arteries and nerves we want to go over, and we know that there is the radial artery, and there are a lot of branches of the radial artery. So this radial artery is going to go from right here, and it's going to have various branches that go all the way down the radial side. The same is for the ulnar nerve, and this is right down this side. Our radial artery goes and will run right here, and our ulnar artery will run right here. We're going to go on to the muscles that move the forearm, wrist, and hand, and we're going to start deep and distal right here at the pronator quadratus, and that goes from the distal 1/4 of the ulna to the distal 1/5 of the radius, and that's responsible for forearm pronation. Another muscle that's responsible for forearm pronation is the pronator teres right here. The pronator teres goes from the medial epicondyle of the humerus and the coronoid process of the ulna, down to the lateral surface of the radius, and that's also, like I said, forearm pronation. As we continue on our lateral side, or our radial side right here, we have our flexor carpi radialis. And our flexor carpi radialis goes from the medial epicondyle of the humerus down to the base of the second and third metacarpal. And that's for wrist flexion and wrist radial deviation. On the medial side right here, we have our flexor carpi ulnaris, and that's from the medial epicondyle of the humerus and the olecranon process of the humerus down to the pisiform, hamate, and base of the fifth metacarpal. And that's for wrist flexion and wrist ulnar deviation. Other muscles that help move the forearm, wrist, and hand, and we're going to start right here. Remember, we're on our anterior side. Right here is our flexor digitorum superficialis, and this goes from the medial epicondyle of the humerus and the coronoid process of the ulna down to insert in the middle phalanges of 2 through 5, and that's for wrist flexion and flexion of the 2 through 5th metacarpal phalangeal joints and the proximal interphalangeal joints. Our next muscle, and right underneath it, so think of the name when we're talking about it, so our flexor digitorum profundus, and that is going to be deep to the superficialis. And that goes from the anterior medial side of the ulna and the interosseous membrane down into the distal phalanges of 2 through 5. And that's also responsible for wrist flexion, flexion of the 2nd through 5th metacarpal phalangeal joints, proximal interphalangeal joints, and distal interphalangeal joints. And the next muscle that we're going to go over is our palmaris longus. And the palmaris longus goes from the medial epicondyle of the humerus down to the flexor retinaculum and the palmar aponeurosis down near the carpals. And this is responsible for wrist flexion. Okay, so we are on the ulnar side of the forearm, and we are going right here to the extensor carpi ulnaris. And the extensor carpi ulnaris goes from the lateral epicondyle of the humerus, and it goes down into the base of the 5th metacarpal. And this is responsible for wrist extension and wrist ulnar deviation. We're going to work our way toward the radial side, and right here we have our extensor carpi radialis longus. And the extensor carpi radialis longus goes from the lateral supracondylar ridge of the humerus down to the base of the 2nd metacarpal, and this is responsible for wrist extension and radial deviation. The next muscle we're going to go over right next to it is the extensor carpi radialis brevis, and this goes from the lateral epicondyle of the humerus down to the base of the 3rd metacarpal, and this is responsible for wrist extension and wrist radial deviation. The last muscle that we're going to go over is right here in the middle. It is the extensor digitorum, and this goes from the lateral epicondyle of the humerus, and it goes down into the distal and middle phalanges of the 2nd through 5th phalanges, and that's responsible for wrist extension, for the extension of the 2nd through 5th MP, PIP, and also the DIP joints. So as you can see, we are on the radial side of the forearm, and I've taken off the superficial muscles. Right here is the supinator muscle, and that goes from the lateral epicondyle of the humerus and the ulna distal to the radial notch, and that inserts in the anterior lateral surface of the radius distal to the radial tuberosity, and the supinator is responsible for forearm supination. The next muscle that we're going to go over is the AB or abductor pollicis longus, and this is the long one right next to the supinator that goes from the proximal dorsal side of the radius and the ulna and the interosseous membrane, and it inserts in the lateral edge of the 1st metacarpal. This is responsible for thumb abduction or abduction and weak wrist extension. The next muscle we're going to go over is the extensor pollicis longus, and that is right here, because remember all the extensor muscles are on the posterior surface of the forearm. And for the extensor pollicis longus, we go from the posterior surface of the ulna and the interosseous membrane, and it inserts on the first distal phalanx. And the extensor pollicis longus, as its name indicates, is responsible for extension of the first MP and IP joints and some weak wrist extension too a little bit. On the anterior side, we have right here is our flexor pollicis longus. And this goes from the anterior radius and the interosseous membrane down to the first distal phalanx. And that's responsible for flexion of the MP joint and a little bit of weak wrist flexion.